Hey everybody, it's 3 a.m. New York time. And like I said, we're not supposed to talk about what goes on at the hospitals. Definitely not supposed to post it on social media. But I mean, I'm gonna end up getting fired. I'm pretty sure of it, because I cannot bite my tongue about what is going on here. I don't feel like I'm fighting the coronavirus. I feel like I am fighting stupidity. That's what it is, or I don't even know. In 2 days, we've had 3 deaths that could have been avoided. Well, I guess 2 deaths, and they coded some other guy, but so far he hasn't died. And I don't know. The virus isn't killing people, it's poor care that's actually killing people. And I know that there was such an influx of patients and you were trying to save as many lives as you can, but people not knowing what they're supposed to do is actually what is harming these patients. And the worst part is when they die, it's just gonna go down as like, oh, they died of COVID. And I'm like, well, are you sure about that? Because we had one guy brought onto the unit, and I don't know the full extent of his history, but he went bradycardic, meaning his heart rate dropped. And the optometrist started, his heart rate dropped down to 40. And in that case, you just push some atropine and bump the heart rate up. Well, from the previous codes the night before, he was told, to push epi, because, that was like a full code. That wasn't bradycardia. And that was like VTAC or something. And so he's telling the nurses to push epi on a patient who should be getting atropine. And it's just a clusterfuck, and they're starting chest compressions on a guy who still has a pulse. And I'm yelling, I'm like, hey, you need to stop chest compressions. He's got an end tidal of 40. He has a pulse. He's like, and they stop and they're looking for a femoral pulse. And they're like, he doesn't have a pulse. And I'm like, he has a pulse. Stop compressions. Because his end tidal is 40. And they keep doing compressions. They push epi. They get the pads on him, like they're gonna shock him. And he's bradycardic, he doesn't need to be shocked, and he probably needs to be paced. And the attending finally comes up, and he's like, who are you? And I'm like, I'm Nicole, I'm a flight nurse. You need to stop these chest compressions. And then, his heart rate comes back, epi will up your heart rate too. It jumps up to 75, then his pressure tanks. And they're like, oh, he's got a heart rate, and everyone stops, and everyone thinks it fines. I'm like, but he doesn't have a blood pressure. It was like systolically 60. And I'm like, can we get some levofed, dopamine? I don't care. Any inotrope that you want, any vasopressin that you want, just put something on him. And then, of course, the blood pressure drops, and he codes again. And at that point, I lost my shit, and I just walked out of there. Because that attending at least knows what he's doing. Don't worry, I wash my hands. He'll keep the optometrist and the fucking dentist in line or something like that. And I lost my shit, and I had to go call my lead, because I'm like, this is the 3rd guy that's gonna die that didn't need to die. This is basic ACLS. They have a damn book. The AHA literally tells you what you're supposed to do in these situations, and they're not doing it. And then there was this whole hour of where the attending is explaining ACLS and all of this crap to the optometrist, and I lost my shit. I broke down crying. I'm not gonna lie. How many of these people have to die before people get their shit together? They're not dying of coronavirus. They have coronavirus, but they're not dying from it. All up and down the damn halls, the vents are set wrong. But because, coronavirus patients don't have normal, responses to treatment, they think that these whacked out values, vital signs, vent settings, think medication levels are completely fine. And you know what? If you treat the symptoms, manage your vent, manage your drips, your medications, all of that stuff, you should be able to pull probably a lot of these people through. I mean, that's kind of what I'm seeing. I have 2 out of my 4 patients from yesterday, and they're ready to be extubated. They're ready to go, and they're over sedating these people. We're running through propofol and fentanyl so fast because everyone is just keeping them like down, like completely sedated. And you know, we have to mix all of our medications, and people are making drug errors left and right that I guess in one of the other ICUs someone died because somebody mixed the wrong med or something like that. I mean, I'm not fighting coronavirus here, people. I mean, I'm fighting fucking stupidity. That's what I'm fighting right now. And I don't even know how I feel. Like, I mean, I literally lost my shit and I started crying and telling my lead, and I'm like, this is 3 people in 2 days that have died unnecessarily. And I mean, I know that we're in East Harlem and shit like that, but this is not acceptable. These people not all of them need to die. We're not fighting coronavirus, we're fighting stupidity here. I mean, I don't even know what to tell you. Nobody knows how to do an EKG. Nobody knows how to read an EKG. Some guy went into VTAC, took a couple minutes before anyone realized he was dying. Like, the actual staff of this hospital, like, don't even give a shit. One of their ET tubes was leaking. They just kept letting the vent alarm. I mean, the stats were dropping. I went in there and fixed it. She never even got up to check on the patient. I mean, I had to transport a patient, and it took me an hour to disconnect this lady from all of her tubings and her vent. Like, luckily the RT set up the vent, but to swap over the tubing, get her onto a new monitor, so that way the guys can take her to like CT and everything like that. And it took me an hour. In the meantime, my other ventilated patient and a ventilator on the other side of the unit, his presser, which keeps his blood pressure up, stopped, and his blood pressure's tanking. And some director of something services, I don't even know, comes up to me and she's like, oh, do you know that your patient has no blood pressure? His medication ran out. And I'm like, are you fucking kidding me? You walked across the unit to find me, to tell me my patient doesn't have a blood pressure while I'm in a room with another patient, and you, I don't know, couldn't find a medication, do something so that way my patient doesn't die? I don't get this. And then, yeah, I'm not fighting coronavirus here, people. I'm fighting fucking stupidity. And then I didn't get a chance to hang my sedation medication on the lady who was going down for CT, because now I'm trying to mix a medication to keep my blood pressure up on my other dude who is tanking. And I guess while I was in that room, my patient down in CT runs out of sedation, and they're pissed off at me because I forgot to hang the next thing of medication, like a propofol, which sedates them, because we were out of fucking propofol. And I had called the pharmacy prior to that, let the charge nurse know, we're out of propofol, we're gonna need propofol. So then they run down there and with some propofol that they found, and they come up and they're like pissed off at me, and in the meantime, the respiratory therapist tries to put the patient on my vent, and you know, it starts alarming and everything like that. Well, my vent tubing sprung a damn leak, because it's God knows how old, a week old, and it's got holes in it. So I have to tape my damn vent tubing together. The filter is completely saturated in there and collecting fluid. So I had to MacGyver it and suction the filter out. And I'm like, hey, where can I get another one of these filters? Because these are supposed to just like, you know, filter the air and allow like humidified moisture to come in. But it's just completely blocked with, you know, phlegm and everything from the suctioning. And the girl's like, I don't know, I'm a traveler too, and I still can't find a manometer or anything like that. And this is out of control. My one guy is a diabetic, and they can't figure out why his, I've got him where he could probably be extubated tomorrow. And he's got this chest tube that was placed several days ago, and it's ready to be taken out. And I tell the resident, I think this guy isn't the dentist. I think he's actually internal medicine. I'm like, hey, you know, I think this chest tube's ready to come out. You know, you just have some serous drainage coming out of it. You know, it's pretty much water blocked. It can come out. And he's like, okay, you know, I'll talk to the attending about it. The chest tube still isn't out. I mean, this thing's gonna get infected. I mean, I'm already having problems keeping him warm because I can't find blankets. We're out of blankets. There's a couple sheets left. I'd poach some off another bed, but every bed is full. There's no blankets on any of the other units. I can't find warming blankets. I used ice packs to warm his hands up because they're starting to turn blue, but I mean, his perfusion is good after I got it back up and running. He's got pressure ulcers developing all over because I can't turn them fast enough. I gotta check the other lady and make sure she doesn't have pressure ulcers, but you know, they haven't hung the feeding tube, like the tube feeding on this guy in 2 days, 3 days, so he hasn't been fed in 2 or 3 days. Blood sugars are actually doing fine, but he's probably in ketosis. I can't find the right feeding tubing to the feeding pump. I figured I could just free fall the feeding, you know, in the tubing that I had. But I can't get it to prime the tubing for some reason. It should just flow right through it. I've tried every trick under the book. I'm probably gonna have to just start feeding him through a syringe, through his NG tube. So friends, when they say things are bad in New York, I think most of it's just stupidity, because I mean, they're like coronavirus and we're on the front lines, and you know what? There's a lot of fucking stupid people here that don't know what they're doing. And like I said, I'm not the smartest and the brightest person, but there are some basic standards of care that we should be doing here. That was a really big rat. I think that was a cat. No, that was a rat. I wonder if it smells my brownie thing. I mean, so how many of these people are actually unnecessarily dying because of the bad care? Like I said, I'm probably gonna get fired anyway because I'm gonna pop off to these physicians, because I'm like, you can't be giving people chest compressions when they have a pulse. You can't just intubate people whenever you want. I'm speaking of the little Hispanic lady that they tried to intubate, the dentist tried to intubate yesterday. She's doing pretty good. Her heart rate's a little high, but she's setting like 90 something on a BiPAP. So she's still off of it, and that's pretty good. But yeah, I nurse taped up my ventilator tubing. This is just ridiculous. They dialysized my guy finally, pulled off a bunch of unnecessary fluid off of him. They put a second central line in his other femoral artery, and I don't know what the fuck they did. It looked like they tried it 5 or 6 times before they got it, and they must not have gotten it because all the lumens are just taped off, and he has been slowly bleeding to death from this like central line by the time I got in there to figure that out. He had just been bleeding into the bed, just like a slow trickle, but you know, after how many hours of that shit happening, how much blood could that have been? I don't know, because nobody put caps on the end of the lumens from that femoral line. When they attempted to place it, they said it was no good in report, but you still, I mean, then pull it or something. Don't leave it there, especially don't leave it with the caps on where it's just gonna free flow out of the damn thing, and he's gonna bleed to death. I mean, you know, he's got pressure ulcers developing everywhere, and he's kind of a big dude. I think he's like a big Italian dude or something. And I mean, he has like good chances of getting off that ventilator. I mean, when I first got him, they were running his respiration rate at like 36 breaths per minute, and I can kind of understand that because his CO2, you know, CO2 PCO2 was really high, and so I titrated him down to a normal respiratory rate. But I'm like really hoping that he didn't have any perfusion issues when I was trying to help the other patient, and that doctor person just, it was like, oh, by the way, your patient doesn't have a blood pressure, and just comes to find me. You know, and oh, that was another thing. When they're dealing with that code with the other patient, like the nursing director of like clinical services or whatever was right there, and I'm telling you, they're killing that patient. And he just shakes his head, and like everyone just shakes their head, and because this is just okay. This is just the standard norm. We're just gonna let this shit happen to these people. And I don't even know what to say about this at all, because this is just stupid. This is absolutely stupid, and I can see why people don't want to renew their contracts with the travel agencies, why some like people have left. And I know that my lead had warned me, because this is how Bob died. The story of Bob and everything. He didn't like take a demise. Somebody fucked up. And that's why he was so upset in the morgue, holding Bob and talking to him. And so right now, I had to take a chill, like, well, I didn't take a chill pill, but I had to like take a chill moment, and like fucking cool down before I yelled and screamed at anybody else. And so I've got one girl who's now managing 4 ventilators. At least one of the rooms is by hers. So hopefully when I come back, they're still gonna be alive. Because how does she know what's gonna happen? Like if you're in one room and 2 other people go to the other time, because apparently no one else is gonna do anything when your alarms go off. I mean, we tried cardioverting some guy. Nobody knew how to use the monitor. We cardiovert him, and I might want to increase the joules to get it to do it again. And they cardiovert him, but then they don't put him on amiodarone to like regulate the heart rate. Of course he fucking goes like 2 hours, like an hour now. It's probably like 30 minutes later. And I'm like, you know, typically we put him on amiodarone after this. Nobody is following basic like medical care anymore. I mean, do you think that because we're in a pandemic? I mean, we have a lot of staff in there. Granted, yeah, I'm still managing 2 ventilators, but this isn't as bad as they were saying, like when they had like 50 people and they were in the hallway on ventilators and things like that. There are thousands of nurses that came from all over the country to be here, and you have staff and you've got enough of the basic supplies, and minus the circuits, I still can't find that. I mean, half these people aren't even on end-tidal CO2. So how do you even know? Because you can't rely on the SpO2 monitor. My paramedics have taught me that. My guy with the chest tube had 2 different blood pressure medications running to keep his blood pressure up, and I tapered one off. I couldn't figure out which one I should taper, so I literally had to call my paramedic friend, and I'm like, hey, this is what I got. Which one would you do? Because I'm kind of torn between which one I should lower. But I mean, every ounce of fluid is going to kill this guy because he needs dialysis, so we can't fluid volume overload him. But all these medications are actually counterproductive. He does not need 2 pressors on him. And sure enough, he didn't. I mean, his pressure only dropped when the med ran out because I was with another patient. Because, you know, no one's going to help you, apparently. Apparently, the administrative people are not going to help you. I mean, the director of whatever nursing services who says that he is of the know of everything going on in this hospital, which, yeah, probably is. I mean, he wasn't going to correct that resident. I mean, he didn't. I'm the only one arguing with him to not push the wrong drug. And, you know, here we have to mix so many of our own medications. There has got to be medication errors going on left and right. Because the pumps are getting titrated all over the place. Like, all of a sudden, you gotta like quadruple a medication out of nowhere. I don't know, guys. I don't think it's coronavirus anymore. I think it's nobody knows what they're doing. It just could be because I'm in a teaching hospital. It probably could just be that. I'm in like a stare off with this like rat over here. These rats are fucking huge. Yeah, but don't come to New York and die here, okay? Or get sick, because you probably die here. I mean, I give up. I'm probably gonna get fired. You know, I was warned when I first got here by my lead, because he used to be a flight nurse too, just to watch it, because, you know, I'm gonna see some shit. And I said, well, yeah, I know. I've seen bad stuff. I've seen bad things. And I'm like, but I don't normally have to see stupidity. Well, yeah, I do. Like, when people do stupid shit and they get hurt, yeah, I saw that. But this is just negligence. This is not the coronavirus. This is just negligence left and right. I feel like I should probably just go in there and DC that chest tube myself and just be like, oops, I kicked it over. It came out before that thing gets infected. They're not going to take it out. I mean, how many days does a person go without being fed while they're intubated? I mean, I have 2 patients ready to get off the ventilator, and one of them I gave a report to in the morning was a trauma nurse, and she's like, they're ready to come off. You know, so they just try to cold turkey them off like the sedation medications, and then they try, oh, they're not ready. In the meantime, their skin is breaking down. We've got all these lines in them. How much of this medication do they actually need? I don't get this, guys. We're not fighting coronavirus, we're fighting stupidity here. And I don't know if I'm gonna finish out this contract if I have to keep seeing this stuff. Because I can't just sit idly by and just watch people kill people. I mean, what I wouldn't do for a good old-fashioned like gunshot wound or a car accident, and rather deal with that right now than watching the optometrists code people. All right. I should probably get back in there and check to make sure that my patients are dead. So you guys have a good night. Stay out of New York. Don't get the coronavirus either, because, you know, you may not, I don't know, they'll probably say that you died of the coronavirus. In actuality, I don't know, chopped your arm off. I mean, how many of these people on their death certificate is it going to say it died of coronavirus? In actuality, it was, you know, medication error, or, you know, staff error. But you know what? Fuck it, whatever. We're in East Harlem. They're just minorities. Nobody cares. I mean, I did not really believe the textbooks when they always say about, you know, how minorities and the health discrepancies. And yeah, I believe it now. I truly do. I mean, we have better access to care and services in the rural setting. And they always say in the books that rural settings are worse off shape for healthcare than cities. Nope. I think the rural communities are better off than the cities here in New York for healthcare. Yeah, so don't get the coronavirus, because someone will, you'll get intubated by an optometrist. Bye, guys.